My father worked all the time. Opera singer, rock band frontman, radio DJ. When I was born, my father had a job, salary, benefits, retirement. He had bought a beautiful Victorian house in Seattle's Central District and was working on the largest Washington State road program in history, the I-90 floating bridge. One day, my mother got a call. My father had been injured on the job. He was in the hospital, in a coma. With my dad unable to work, we couldn't afford the mortgage payments and lost the house, moving to the low-rent district a few miles south. I remember cold mornings in line at the food bank, lines stretching around the building, down the block, the heart of the projects, nervously hoping that there would be enough to get us to next week. My father was taken to court by the state for his medical debt sometime in 1985. Taken to a hospital unsupported by his insurance, workman's comp would not cover the treatment costs. The state would not pay for his disability. The hospital would not forgive the emergency fees. In 1988, with no medical coverage, my father went to the doctor. He had had a recurring sore throat, was having difficulty swallowing, and suffering bouts of acid reflux. My father had been told repeatedly to go home, not to eat spicy food, and treated like any cold or flu. This doctor, while checking for strep, observed a lump in the back of his throat and had a diagnosis. My father, the opera singer, had a tumor attached to his vocal cords. He was given chemo and a prayer book. I watched my father waste away for those months. We were evicted from our house again. My sister sent to live with my grandmother. I was repeatedly reminded that I was the man in the family now. 6 months after his death, my mother got a letter from the state. They would award him some disability and workers' comp, cover medical expenses, and give him back his health insurance. We talk a lot about the healthcare crisis in America today. I laugh because I remember the healthcare crisis 20 years ago.